to The Other Side of Leadership, a series by SomiDocs that explores leadership beyond titles, roles, and any traditional hierarchies. In medicine and healthcare, leadership is often defined by position. But every day, there are women shaping teams, supporting colleagues, mentoring others, and creating impact in ways that may not always be visible or formally recognized. So this series highlights those moments, the quiet influence, the meaningful presence, and the everyday actions that redefine that leadership and what it truly looks like. So today, I have the privilege of speaking with Marnie Hochman, who serves as a nurse practitioner, family nurse practitioner at Antiba Hospice. And what stands out the most about Marnie is truly how she leads through empathy, through example, showing people, her students, and people surrounding her how to consistently show up and impact those around her. So I'm very happy and pleased to introduce Marnie Hockman, my dear friend, and someone that I truly, truly admire and have been for many years. So Marnie, welcome.
Thank you for having me.
It's my pleasure. So the first question that I have for you is, when you hear the word leadership, and I know that this is going to be a touchy one, when we hear the word leadership, what does it really mean to you today? Not the textbook definition or anything like that. Just what does leadership mean to you?
Taking on a role that allows you to listen to other people, their concerns, good and bad, and being a role model.
That's a great definition. I love it. Especially you are a great role model. So
thank you.
Let me ask you this. Have you ever had a moment in which you have felt like a leader, but nobody formally recognized it?
Almost day to day. As an NP, I work with a lot of nurses, and I often meet them out at assisted livings or skilled nursing facilities, and they look to me for advice on how to, treat someone, or whether that's in a in a physical manner, or just to bounce ideas off me. And no matter what it is, I always try to respond to them, even if it's what they think is the silliest question, with respect and compassion, and give them the best answer that I know how.
It's so important, because you would think nurses may not necessarily look up to a nurse practitioner in that way. And the fact that you give them that comfort in asking you questions, like you said, even in the silliest questions, and make them feel comfortable, continue asking you and reaching out to you. That's fantastic. Which leads to the other title that I didn't mention originally, which is you're an adjunct professor at Barry University. Yeah. What makes you a leader there?
Not only have I been there for years, I went there for undergrad and grad, but I make students feel comfortable so that they aren't afraid to come to me. And that's so important when you're in that teacher role, that students, again, no matter what the question is, I have an open door policy, and that means office, text, phone, whatever they need. It's about meeting the needs of the student and empowering them so that they'll be able to someday take care of me.
That's true. That's true. It's sad, but true. Talk to us. I know the answer to this, but talk to us a little bit about, what do you do with your students? That's something that made a huge impact on me personally, but I would like for you to talk about it, because I believe that that's one of the things that makes you such a huge leader, beautiful leader.
Thank you. I've had many different roles since working at Barry, but the last maybe 10 years, I'm dating myself, I've run a community class where I bring students out in the community so that they get to see nursing isn't just working on a hospital floor. Nursing is in the penal system or jail. It's homeless shelters. It's working with, every diverse group, going into skilled nursing facilities. It's about teaching them how to teach, because patients need a lot of teaching. So the community class allows me to bring my students what I like to call, in quotes, field trips. And we go once a week to a different organization. And usually it's underprivileged, underserved, but open to anything where we teach, we learn, we educate. And this is so my students know that, again, nursing isn't just floor nursing. There's so many opportunities for a nurse. And I want to show them that.
That is beautiful. What do you think is one of the most impactful? I know that you've done it for, you said 10 years, but what do you think it's been one of the most impactful places where you've taken the students, and what type of comments have you received from them?
Definitely the homeless shelter stands out. People are so appreciative. You do not know what giving a homeless person a new clean pair of socks does for them. There was in Miami Beach, unfortunately, they closed down, but there was a foot clinic that I was a part of once a week where we went and gave foot care. Maybe not the ideal job for some, but nonetheless, really made an impact on the clients. I don't even want to say patients. These are people's brothers, husbands, cousins, friends, and they're so appreciative of every little thing. But as I said, giving them a pair of clean socks really and that will stay with me the rest of my life.
We'll be right back.
What if networking in healthcare actually worked the way it was supposed to? No chasing posts, no algorithms deciding what you see. We built a WhatsApp community for healthcare professionals, where conversations happen in real time and people actually respond. One of those spaces is Leadership for Women in Healthcare, and these are some of the women inside it. Beyond that, there are rooms for AI, business and medicine, non-clinical paths, students, and more. You step in where it fits, and you start connecting right away.
Let's get back to the show.
And they're so appreciative of every little thing. But as I said, giving them a pair of clean socks really and that will stay with me the rest of my life.
That's impressive. And the things that we take for granted on a daily basis.
Correct.
And what type of comments have you received from your students by taking them to these places?
Just overjoyed. They felt empowered. They felt compassion. They felt like they gave back to the community. They pat themselves on the back, and such a nice feeling. We do go into the hospitals, and you're not going to have every patient or family member that thanks you or is appreciative, or, you get a lot of, what have you done for me lately? But when you get those patients that are just so grateful, it means the world. And the students see that as well.
That's fantastic. And what a huge lesson to teach students in general, but specifically most of your students, I would assume, early 20s, late teens. And that's something that, especially if they have grown with privileges, it's something that they don't often get to see. So it's an impressive way of showing leadership and showing to pay it forward, right?
Yes, 1,000%.
The opportunities that you have. So let's shift a little bit to your current job, which I think that you have done for many years as well, in Antiba Hospice. And that's another reason why I admire you so much, because I believe that it takes a personality of gold and strong personality with vulnerability to be able to take care of a patient and their families during a hospice situation. So can you talk to us a little bit about a time in which you felt, again, like a leader in with one of your hospice patients?
Actually, just yesterday, I was assigned a patient over the weekend blindly. They weren't even in my territory. And I was asked to go see this patient, and one daughter lives in Miami, and the other daughter lives out of state. And I walked in, and mom was actively dying, and the daughter that was there didn't know that. She knew mom had declined in the past 48 hours, but she wasn't aware of how imminent she was. And again, I had no clue what I was walking into. I thought mom would have been sitting up on the couch and I was just doing a check or a physical. So within a short period of time, I was able to get crisis care in there. So that means that we have a nurse sitting at bedside 24 hours. I called the other daughter out of state, and I was on the phone with her for a pretty long time, explaining her what's happening with her mom. And I found out that she passed at 10 p.m. last night. And I was actually taken back. I really thought she had a couple of days. But she went peacefully, and the family was so gracious. And just the text that I received today from the family members thanking me, it really made everything worthwhile.
You're
And
gonna make
so
me cry.
you don't always get that, death brings out a lot in different people, whether, it's anger or sadness, but what I got from them was just overwhelming, like graciousness. And it really made my day. Yeah.
Wow. Wow. That's beautiful. It's sad but beautiful. And the way
Yes.
that you were able to enable at least the transition of feelings, right? That, like you were mentioning, somebody that was not prepared, not only not prepared, but came as a bucket of ice, and then
Right.
a few hours later it happened. So that's impressive. So what have you had to unlearn about leadership?
Leadership doesn't always mean you have the answers. Sometimes you have to look for them. That's what I have found in being a leader. And then having leaders, I guess, to say it in a way, not everyone is even if they have the title, not everyone is a leader. And you still treat everyone with respect, no matter what. You smile, but deep down that not everyone is meant for every job. And ironically, I first had gotten a master's degree in nursing administration, and I was an administrator of a home health agency. And after a couple of years, I realized, no, I really miss patients. Like, I don't want the complaints on a daily basis. I don't want that role. And that's when I became a family nurse practitioner. So I do lead, as I said, nurses and home health aides and family members, but I'm not, technically in a leadership position, and that's okay.
I think that that's more than okay. I think that if not having the title gives you the opportunity to do all the things that you've shared with us today, that to me is way more important. And to your point earlier, there are a lot of people with the title that are definitely not leaders or somebody that you would like to follow. So that's huge.
Yes.
Let's close with one more question. And this question is, how do you personally measure your own impact?
Going back to yesterday, today when I received the message that she had passed, and then the family reached out to me, that was a 10 right there. So that measured that.
Yeah.
And knowing that her death, although it was a death, it was a beautiful death. And the family received the support they needed. The daughter was exhausted, the one that was with the mom. And I said to her, she was giving meds and she was trying to move the mom. And I said, you're entitled to be a daughter. It's your time to just be a daughter and not a caregiver. So let me take that on. Let me worry about that, and you be the daughter. And I was able to, as I said, intervene and get her the support that she needed. So that is, to me, that's a 10. And that was the measurement. And that was, as I said, just yesterday.
It's the quality, not the quantity that you're measuring. And
For sure.
That's huge. So thank you so much for being part of this conversation, Marnie.
Thank you.
And for sharing all of your perspectives. I hope that I wish that we had a little bit more time, but what you've shared today is exactly what this series is about. It's about leadership that isn't always visible, but it's definitely deeply impactful. And to everyone watching or listening, we hope that this conversation expands how you see leadership, not just in others, but also in yourselves. I'm Silvana Fishman, and this is The Other Side of Leadership. Thank you, everybody.